Hi, I'm Dr. Stuart Jones, the Director of the Ohio Health Fibroid Center of Excellence. Fibroids are muscle growths that occur within the uterus. They can be anywhere from the size of a pea all the way up to the size of a softball. They can be on the inside of the uterus, on the outside of the uterus, but they can cause problems. And they account for actually 30% of all hysterectomies that are done in the United States each year. Truly, any woman is at risk for getting uterine fibroids. However, having said that, there is one group, and that is the African American population, that is at a greater risk for developing these. 50% of women actually will have a uterine fibroid by the time they turn 50, so they're very common. If you're diagnosed with uterine fibroids, you don't necessarily have to have surgery. And that truly is the reason that we formed the Ohio Health Fibroid Center of Excellence, to give women the options of what could be done other than a major surgical procedure. Many women don't realize there are less invasive procedures, and so what they do is they don't go ahead and they don't have treatments. They put up with the day-to-day problems of the uterine fibroids, heavy bleeding as such. So our job was to educate women, to make them realize that we do have other options, whether it be uterine artery embolization or MR-guided focused ultrasound that we have at Ohio Health, one of only 16 in the United States. There are multiple different symptoms that are present, one being heavy bleeding, irregular bleeding, pressure on the bladder, pressure on the bowel actually creating constipation, and occasionally actually bowel obstruction. Infertility is another causative factor from fibroids. Sometimes they won't allow a woman to become pregnant or actually carry the pregnancy. Uterine fibroids can occur at any time in a woman's life. They could be during the reproductive years or even after reproductive years. The time it's going to be identified is going to be at that yearly visit, so I always stress making sure that they do go to their doctor's appointments every year. The other time that a uterine fibroid may be found is if a woman has those symptoms of uterine fibroids that we discussed earlier.